Hey, good afternoon. Welcome to Facebook Live at CGH or from CGH Medical Center. I'm Dr. Bill Bird. I'm the Chief Medical Officer here at CGH Medical Center, and thanks to those of you who are listening now and who will listen in the future to this broadcast. This week is, we've done this earlier on in these conversations, but I wanted to circle back and talk about mental health. It's definitely it continues to be in the news, but it's a big component of what's going on right now. And I've asked Christine Romesburg to join me. Christine actually was on this broadcast in early April. You didn't see her because at that time we hadn't figured out how to get everybody 6 foot apart and how to do this Facebook Live in a way that we could do it safely. So I'm glad to have Christine. Christine, welcome.
Thank you.
Glad to have you.
Thanks for having me.
Yeah. And Christine is a counselor who works with something called Ways to Wellness here at CGH, and we'll get into what that is in a little bit. But what I wanted to start with, just asking Christine basically what her experience has been as a mental health professional from kind of when we talked with each other in early April until now, and what kind of mental health issues you saw then, what you're seeing now. And if you would speak to that, Christine, that'd be great.
Yeah, so in April it was a much different time. We had a lot of changes happen very fast, and it was learning how to cope with that. But we thought it would only be like a month or two of those changes. And now it's been 5 months, and the biggest anxiety I'm hearing from my patients is there's no end in sight. And that's becoming overwhelming for a lot of people. Also in April, we started e-learning. Didn't think we'd be going into the next school year with issues, and parents are having to make a lot of difficult decisions regarding their kids that have never had to be made before. And there's no handbook on how to cope in these situations. A lot of people are still fearful about their health, and so that's causing a lot of anxiety. Many people have lost jobs due to COVID or lost their support, such as daycare. So that's causing a lot of financial burdens too for individuals, which can lead to issues with mental health.
You know, I remember when we talked last time, there's the other thing that I remember it really struck me was that you said that at that time you had some clients you've had for a while and who had anxiety and other issues, and really you hadn't heard a lot from them. You know, there were other things that were going on.
Yeah.
Has that changed?
Yeah, I think and what we were talking about last time was social anxiety. A lot of patients with social anxiety, they then got to stay at home and didn't have to be social, so that, that wasn't an issue anymore. But and we've moved into a different phase where we are in the community, more people are working, so back to that anxiety with that, and on top of that, all these new social norms that have been difficult for people to adjust to, such as wearing masks in grocery stores and all that. So it's different anxiety now than it probably was in April.
Yeah, okay. And speaking of this anxiety, I read this newspaper article a couple days ago, and it was talking about, many of you may have read this too, but it was talking about at this time last year, I think 1 in 12 Americans had some form of anxiety disorder type symptoms, and now it's 1 in 3. So, if you're someone who's listening to this or knows someone who is experiencing this, you are definitely not alone. It's pandemic to the pandemic, if you will, in terms of anxiety. So and the follow-up, I guess, in my mind, Christina, that there is anxiety, this is a reality. What would you say, what have you been able to do, what are you seeing in terms of ways from a mental health perspective that can help folks?
Well, of course, I think it's important just to reach out if you need to, and that doesn't mean you necessarily need to talk to a professional, but reach out to family and friends. Take care of ourselves, be kind to ourselves. None of us have been through this before. So making sure you're taking good care of yourself, getting sleep, exercising, getting outside, and then if you need to disconnect from the news or social media, because that can be overwhelming for a lot of people, turn it off. And just making sure we're looking out for one another too, and again being kind.
Yeah. Are there? And I forgot to mention. I asked you this too. Are there any age-specific things about how what you're recommending or what you see?
Yeah, that's a great question. I think this population gets missed a lot right now, and I think they're struggling quite a bit is the geriatric population. Obviously, they have more risks, so they've been more cautious. So they've been at home now for an extremely long time with limited support. You've got to remember a lot of them may be widows, and their family might not be as readily available. So making sure we're reaching out to, our grandparents and our parents, making sure they're doing okay, as well as the chronically ill, any individuals with long-standing health issues where they have to have been more cautious in staying home because we are social beings, we need that social interaction. So making sure we're looking out for them. A huge issue the CDC has brought up is substance abuse. We're seeing it here in an increase when there's people losing jobs, anxiety, depression, people are going to reach out for unhealthy coping mechanisms. So again, that's been on the rise. And then strangely, another population I think isn't getting enough attention they deserve is people who are losing loved ones during this time. Their support is limited with support groups not being available, and maybe they're having to quarantine because of what's going on while they need that social interaction trying to get through the loss of a loved one. So yeah, those are the populations I think that maybe need extra attention on top of, we've had celebrities and politicians, Michelle Obama talking about how the pandemic has affected her wellness and depression. So it's affecting everybody. So just making sure we're reaching out for that support when we need to.
Yeah, good. This is just kind of my little sliver of the world that I live in. But you talk about taking care of yourself, and I wonder a little bit about this too, is like in March and April, I saw a lot of people walking outside of my home, and I kind of, now I'm back to seeing the regulars walk, but I don't really see the folks that I'm like, oh, that's nice that they're getting out, and it makes me wonder a little bit about taking care of yourself and how when you get busy with other things, it's harder and harder to do that. Yeah. Okay. So I think the next thing I want to ask you is, let's get into a little bit about, specific to our community, can you speak to what you do in Ways to Wellness to help folks in our communities who have mental health issues?
Yeah, of course. So we obviously do the counseling side of it, that emotional support, helping them find resources. Like I said, a lot of people lost their jobs during this time, so if you lose your job, you typically lose your insurance. So I can help, look through the different resources, Medicaid, Medicare, Affordable Care Act, power of attorney paperwork. There's a lot of things that we do have in this community to help people. So I feel like if I can't help you, I'm going to find the resources for that person. And, don't be embarrassed to reach out if you need help, because we're all struggling right now. So just, I'm here. You can always talk to your doctor about getting a referral to me or get put on my schedule, or reach out to me. My extension in the clinic is 1916. Again, that's 1916, so you can always leave me a voicemail if you need to talk or want to schedule an appointment. And right now, I'm doing phone, Zoom, or in person, so whatever patients are comfortable with, we can definitely accommodate you and make sure we get you the help you need.
Good. And just to be even clearer about how to get hold of Christine, I'm pretty sure the number you would call, is it the hospital number, right? Or the clinic? Okay,
clinic.
So it'll be 815-625-4790, and then you ask for that extension 1916. So yeah, for those of you who are out there, and you can share that as well. But yeah, great. So this is, I think, what's unique about what Christine is doing, and we're so glad that she's here and able to offer this, and is that, yes, she's a counselor and does do counseling with folks, but also either on her own or because of the connection she has, she can take care of things outside of what we would traditionally call a counseling session. If you have other issues, and that's really the beauty of what Christine does. So yes, please be aware that that is available for you. If you would, just kind of speak a little bit to like other mental health services we have in the area.
So of course you got Mississippi Centers. Whiteside County Health Department has a lot of great resources. I know there's been some struggles getting people in during the pandemic, but everyone's running. They got, again, doing Zoom or in person. I think a lot of them are now. So yeah, and then you got a bunch of private practices if that's what you're looking into. So the community's full of resources. You just need to reach out and access them.
Yeah. And I know over where I live in Morrison, I know they do some work there at the hospital for folks. I'm not as familiar with what they do over in Dixon, but I'm sure they have some sort of something through the hospital there too. Okay, next question that struck me that I wanted to ask you is, when does a person decide that their mental health issue is to the point that they need to see a physician or a nurse practitioner for potentially medication or those kind of things, versus reaching out to you for counseling and or other services that you're able to provide, Christine?
So the reality of the situation on that is 90% of people are going to reach out to their PCP. That's who they have that rapport with. That's who they're comfortable with. Luckily at CGH, there's so many great physicians that know how to handle this. And of course, when you see a physician, anytime you're going to get screened for anxiety and depression. And if that is an issue that got triggered, your physician will talk to you about that. And a lot of times the physicians, if they do have issues and don't know what to do with a mental health concern, we collaborate together trying to find the best resources for that person. And then research is going to tell you that counseling mixed with pharmaceutical interventions is going to be the best way to treat any mental illness. However, I tell patients it's what they feel they're comfortable with. Some people prefer just to try out an antidepressant with their physician. Some people don't want to use pharmaceuticals and want to try coping skills. So whatever you feel works for you, and then if it doesn't work, talk to your doctor and try a different way. But yeah, there's a lot of options for people.
Yeah, I can just speak for my career as a PCP, and people would typically start with me, and would come to me, and this is just my way of looking at it. Is there were certain patients that saw me, and as best I could tell, there wasn't anything really burning behind the scenes that was contributing to anxiety or depression. So their social situation, by and large, from their perspective, was probably status quo, and life hadn't really changed, but they felt mentally different. Those are the folks I tended to put on medicine and see how that worked. I had other folks, though, who did have other things going on in their lives, and those are the folks that we would either send to counseling or put on medicine and send to counseling both. And we would usually start with one of those two routes and then kind of go from there, just for those of you who might be curious about how that whole process works. That's typically how we did it. So does that sound pretty reasonable?
Yeah, and a lot of times the medications don't even have to be long term. Say like someone's going through issues right now with grief and loss, we can, the doctor can just do medication for a little bit. It doesn't mean it's long term. Same with counseling. Some patients see me 1 or 2 times and they're good to go. So it's based on every person, and every person's different.
Yeah, I just talked to someone who saw you a couple times and they felt really good. There's definitely that part of things that can go pretty well that way too. Good. So I wanted to talk a little bit about, do you have any, you probably know through Mississippi, if nothing else, or the health department, what the plan is for mental health with schools, what it has been, and what they're thinking about in terms of if schools, whether they open up, some hybrid, or they open up online, what resources are. Wasn't one of the questions, but I'm thinking about it as we were talking. Any thoughts on that, Christine?
Yeah, that's a good question because nobody really knows what's going to happen in the fall. But Mississippi has typically every year there's counselors, and there's so many different school districts in the area. So usually there's counselors on staff. I don't know if that's going to be the same, but there will be counselors available either through Zoom or on site for patients. And of course, I've seen kids throughout the summer. So there's options for you in that area. It kind of just depends what ends up happening with the school when we start.
Yeah, okay. Yeah, and speaking of the schools, we might get into that a little bit more in the next week or two. Boy, it's sure trending in the big cities towards online. I just see that New York is the only holdout right now in terms of not doing all online school for the first quarter of the year or so. So, every school district, based upon, I'm guessing, their resources, the the number of cases in their community, are probably weighing that all together in terms of whether or not they go and try to do live classes, or some combination of live and online. Yeah, it will be interesting, and it will be interesting on our part, from the hospital's part, in terms of the testing, or in the health department. To be honest, I mean, you know, in terms of, like, let's say a kiddo gets sick or a teacher gets sick or has symptoms, you know, just that whole, okay, what are we going to do now? So yeah, it's going to be a work in progress. So okay, and another question I wanted to ask you, Christine, was like how do I mean, this is a great resource to have you doing what you're doing. How does that get paid for?
Yeah, so every time I get the pleasure of speaking of this amazing program, I have to give appreciation to the foundation. The CGH Foundation fully funds this, so it is completely of no cost to patients. I mean, that's amazing. I don't really know any other hospital system that not only cares about your physical health, but also is worried about your wellness and pays for it completely. So again, thanks to the foundation for funding this. Yeah, it's amazing. It saves lives. So I really am happy that we have this in this community.
Yeah, thanks for sharing that, Christine. And I'm a very big supporter of the foundation, the work that they're doing as well. So obviously they're on our website or Facebook page. I'm sure you can look a little more at the foundation and the services that we offer and the programs that we support through the foundation. And yeah, any support you'd be willing to give would be much appreciated. I have a few other questions here. Let's see what we have. Okay. Okay, so a few things here. And some of these are mental health and some of these are just general, you know, other questions. But what are the reasons that we're seeing the uptick in cases? Yeah, I think it's to what Christine was talking about, where, you know, folks at some point in time, because we're social creatures, find themselves getting out, and when they get out in situations that aren't as protected. I do think the encouraging thing in the last 2 or 3 days, I've seen a bit of a downtrend nationwide, which I would attribute to that probably there's a little bit of less getting out and about, and also more of wearing masks and those kind of things, because that's become much more commonplace, which is great. And then the other question that came in about was, are hospitalizations also increasing? Yeah, right now they're not. I should say in the state of Illinois, just ever so slight of an uptick, but by and large, hospitalizations are holding pretty steady, and I think that the reason that is more of the folks who are getting COVID right now are younger, and those younger folks don't tend to need to be hospitalized as often. So that's probably why we're not seeing as much of an uptick in the hospitalizations for COVID. We are, I mean, but like I think our numbers, did I write those down? Anyhow, I don't know what we were at last week. Do you remember, Dana or Matt, what we were for total cases? We're at like 141 for the hospital today. So I think we were in the 120s last week, if I remember right. So we continue to have, on average, a few cases a day just for the hospital. That doesn't include the county. So yeah, it's definitely still ongoing. What does an inconclusive mean on a COVID test? Yeah, I maybe need a little more information on that, because my understanding is the PCR testing that we do is usually positive or negative. I don't know if we're talking about an antibody test. Yeah, I need a little more information. I'm sorry I can't answer that question any further than that. Okay, this one's about a patient who has been using us for a long time, for decades. And okay, so the patient went to Ready Care and ended up having to go to the ED. And I think it had to do with also, it said that their chest was sore. So my guess is, in the course of the interaction with the Ready Care staff, that it was their perspective that they're, in addition to either that they thought that if you had COVID, it may be more significant than the typical case they see at ReadyCare. In other words, there may be some chest involvement that might need an x-ray, which they don't do down in ReadyCare, or they might have thought that it was perhaps heart related too. So one of those two things is my guess of why our ReadyCare folks would have sent someone to the ED. Because it's my perspective, that doesn't happen very often. So I feel bad for whoever sent me this, that they had to go through that. There was the extra expense of doing an ED visit and all those kind of things. But if I were to, with the information that I have that I'm looking at, that would be my guess is why you ended up in the ED. Good question. There was a question, and part of that was the follow-up was it seems like we're getting paranoid now, and I think we're just trying to be careful. I don't think the word paranoid comes to mind when I think about these things. I mean, that's obviously the viewer's perspective, but what I do see is that, you know, when people have COVID stuff and they have symptoms that sound a little bit more than what we're used to hearing, we know that spiral can begin pretty quickly. And so I think there's that sense of we want to make sure that we're getting on top of this right away, rather than having you be someplace, go home, and then come back really sick. So hope that answers the question as best. That's as best I can answer it. Okay. While we're waiting to see if we have any other questions, I wanted just to kind of give a couple other things, just so you understand that this is testing wise. We're struggling with we're still doing okay with our testing. We're testing symptomatic patients that show up to ReadyCare, and if you're asymptomatic and you're an essential worker, we're testing you in ReadyCare. But we're not testing you in ReadyCare if you don't have any symptoms and you're not an essential worker. And it's because our testing supplies, we have them, but they're not like real robust. And I just saw a headline today that Advocate Aurora, which is a really big outfit that is out of Chicago and Wisconsin, kind of along the Milwaukee corridor there, that they are closing most of their testing sites. And the reason is because their testing supplies are becoming more limited. So yeah, for whatever reason, it is not unique to us that this testing thing is happening, even at these big outfits that have, from my perspective, a lot more, if resources is the word, or contacts I would think, to get the testing supplies, and here they are still struggling with that too. Yeah, and here we are 5-6 months out, and still talking about having testing supplies I know we can only control what we can control here at the local level, but it is pretty frustrating to hear that, in that it seems like there would be some resources available to pay some folks to ramp up but anyhow, I digress. I did want to say that next week I'm looking forward to Jeff Wright, who is the outpatient rehab manager, or director I should say, will be here, and we'll be talking about what's going on with rehab services here at CGH. So looking forward to having Jeff with me. I wanted to my thank you this week is to our information technology department. They do a really good job. For those of you who work in companies, that you know that IT folks are the folks that you go, would you, and they kind of find a way to fix it. Our IT folks are great at that. Our employee of the month this month is Doug Hareen, and Doug does IT work and does really good work here in the IT department. So shout out to Doug and to the entire department today. So I want to make sure, maybe I have another one here. Okay, this is a person saying, I want to thank everyone at the clinic for all you were doing. Had to see a doctor on Tuesday and also had to have x-ray and labs, and all went very smoothly. No real wait time, and everyone was great. Another note, I missed the bow tie. Sorry. Well, it's only on Thursdays, so when we have Thursday ones, I'll do the bow tie, but otherwise I kind of like the cash otherwise. Even though I wear a bow tie on Thursday, I tend to be someone who would feel comfortable in jeans and a t-shirt by and large. So, okay, thank you for the kind words though. And I'm going to give it just a moment here to make sure, do we have anything else coming in, Dana? Okay, we do. Okay. I don't want to keep any longer than I need to, but I want to answer as many questions as you have. So here it comes anytime now. What was the comment, Dana?
Are cases getting worse or better in Whiteside County?
Okay, the question was, are cases getting worse or better in Whiteside County? So if we're talking about, let me go back here, maybe I have that now. Yeah, I guess it depends how you define that. So once again, I'm thankful that the vast majority of folks are going to Ready Care. The vast majority of our positives are coming from Ready Care right now. So that's good. Those are folks who have symptoms, but they're not so sick they need to be in the hospital. And I think, once again, because it seems like the demographic that's getting sick is younger, then I would say that in that regard, cases are better in Whiteside County. In terms of the number of cases, that, okay, you have to hold that up for me a little bit longer. In terms of the number of cases, that number continues to go up, and it's, you know, it's going up more than it was definitely a couple months ago. So in that case, I would say it's worse. And okay, I have the Whiteside County numbers. Thanks, Dana. So 348 cases in the county. So I think our number at the hospital is like 141. So it just tells you, yeah, there's more than what we're even doing, and 16 deaths in the county. So yeah, it's a pretty sizable number, that's for sure. And I remember reading a couple weeks ago, I think right now the thought is that, what's that now?
9 new cases.
Oh, 9 reported yesterday. Yeah, okay. So to answer the questioner's question, I guess we would say it's up a little bit. What was I going to say? Oh, yeah, so you have 349 cases, and right now the data that we have is that 40% of the people that are sick, I shouldn't say sick, 40% of the people that have COVID don't have symptoms. So if you do the math on that, which I'm not real good on here live, but 40% more than what that 348 is would give you some sense here in the county. And I just read the numbers on our county, just Whiteside County's some demographics. I think we have 50,000, 55,000 people in the county. Is that right? Yeah.
59.
So, huh?
59.
59. Okay. So 59,000, and you're probably talking 348 plus 40%. You're probably talking one in every 60 people. That, which is not, thank goodness it's not like, 30 out of 60 people, but at least 1 out of 60 people have had if you were to test them, they have had COVID during these last 5 or 6 months. So at 9 new ones a day yesterday, that number is still going up. So it's still still a reality. It's and you know what, we were talking about this yesterday. Some people will say, well, it's just a new normal. It is, but I kind of just like to be my thinking more and more is that it's not normal, and it's okay that it's not normal, and in some ways it sucks, right? I mean, what we wanted, I'm sure all of you had, here's what I'm doing right now in my life, and here's what I had planned this summer to do. Here's the people I wanted to be around. Here's the conversations live, and wedding receptions, or all these things that I was hoping to have. And that gap between those two things, yeah, it's suffering, and it's okay. I think maybe you can speak to this, Christine. It's okay to just say, this is hard, and it's not normal, and it's.
Personally, I mean, I've struggled too, looking at the big picture of everything, and I have to take a step back and remember mindfulness and take it one day at a time, because it is overwhelming. Worrying about childcare, worrying about school, worrying about all these things, is very overwhelming, and Dr. Bird's right. It's not fun to go through, and it's unfortunate that we're here.
So, Dana, do I have anything else? Or, oh, we do. Okay. Well, I thank you for your questions, everybody. Let's see what we have here, and you can just tell me if you want.
There's so much conflict about wearing or not wearing a mask when we're out in public.
Yeah.
What's your opinion on this topic?
Okay, there's a lot of conflict about wearing or not wearing a mask when people are out in public. What's my opinion on this? My opinion is that for those of you who are listening and will be listening to this, when you're in public, I would just wear a mask. I just think there's not a lot of doubt right now about the science, about whether or not it helps to wear a mask. It does. You know, it's becoming clearer and clearer that that's the case. In terms of the conflict in public, in the hospital here, I am trying my best, and I'm not someone who just loves conflict, but I'm trying my best when I see patients or I see staff, and they're usually wearing their face mask, but it's down here and that kind of thing. I'm trying to just say, hey, would you please make sure you have your face mask up above your nostrils, and that's here at work, and I'm pretty comfortable about doing that here at work. And you know, if you see one of our employees that while they're at work here and they don't have their face mask the way that you understand that they would be wearing it, I think it's very, I mean, you don't have to, but it's very okay to say, hey, would you mind pulling that face mask up? Most of our folks do a great job with it, by the way, but there's always, when you have 1,500 people, you're going to have some folks who, for whatever reason, aren't as good at that. In the public, like what would I do? What would my opinion be if I were at Casey's or if I'm at Walmart and someone either is not wearing a face mask or they're wearing it the way that I wouldn't want them to wear it? I'm not going to take that on. I don't feel like that is as much as I would like to say something, I just feel like that's an argument and then some sort of escalation waiting to happen. And so, I think those places are struggling of how to get that done there. But my feeling would be that, once again, I want to control what I can, which is me. And I can wear a face mask. I can do the right thing. And I would encourage everyone that can. And the more folks that do that, the more that drives down the amount of exposures that we have. So that's my opinion about that. Christine, do you have anything else you want to add about that?
I completely agree with what Dr. Bird's saying, and again, it comes back to just respecting each other. A lot of the people that are working in the stores are not bouncers per se, so let's respect each other, and then again, don't escalate people if their views are different than yours, and keep your distance if it's uncomfortable, but again, just be kind to one another.
Yep. Okay. Other questions? Okay. Hey, thanks for all of you for listening. Christine, thanks. It was very nice to have you here. I hope I don't have to have you back in 5 months, but there are no guarantees that I may not have Christine back to talk about this some more. So thanks for listening.